Hey everyone, getting ready for that big clinical psychologist interview.
We're here to help.
That's right. Today we are diving deep into RoleCatcher's career and interview guides to give you the inside track on how to really impress those interviewers.
Interviews can be kind of nerve-wracking.
Definitely.
But with a little prep work,
Yeah.
you can walk in feeling confident or ready to show them what you've got.
Absolutely. So before we jump into the questions, I want to touch on something RoleCatcher highlights. They're AI-powered tools. They have this amazing resume builder and a massive library of interview questions. And what's really cool is that their AI can actually help tailor your answers to the specific job that you're interviewing for.
Oh, yeah. Imagine having a system that analyzes the job description
Yeah.
and pinpoints the exact skills that the employer is looking for.
Right.
That's what RoleCatcher does. And then it helps you weave those skills into your responses.
Wow.
So you're not just giving those generic answers, You're giving answers that directly address what they want to hear.
That's incredible. Okay, so now let's dive into some of those common interview questions. I'm pulling these straight from RoleCatcher's guides. Are you ready to unpack these?
Let's do it. Let's give our listeners the tools they need to really stand out.
All right, so let's start with a question that gets to the heart of what she'll be doing. How do you approach the assessment and diagnosis of a new patient?
So this is where you really want to showcase your understanding of a systematic and ethical approach to assessment.
Right.
It's not just about jumping to conclusions, right?
Right.
It's about carefully and thoughtfully gathering all of the information.
The interview guide suggests highlighting the use of standardized assessments. Can you talk a bit more about that?
Sure. So standardized assessments are tools that have been rigorously tested and shown to be reliable and valid. And they provide a consistent way to measure things like intelligence and personality traits, or symptoms of mental health conditions. Think of them as like a measuring stick that helps us understand the client's current state.
So it's not just about chatting with the patient. It's about using these tools.
Yeah.
To get a more kind of objective understanding.
Exactly. But it's not just about the tools either.
Right.
You also want to emphasize a holistic approach. And that means considering not just the symptoms, but also, the person's individual, personal, social, and cultural context.
Oh, so like painting a full picture of the person.
Exactly.
Not just focusing on their diagnosis.
Yeah.
The guide also emphasizes the importance of ethical considerations. What are some key ethical considerations that come to mind?
Well, informed consent is huge EE.
Okay.
You want to make sure that the patient fully understands the assessment process, the potential risks and benefits, and their right to refuse to participate.
Of course.
Confidentiality is also really important.
Right.
Patients need to feel confident that whatever they share is going to be kept private.
Absolutely. And don't forget about cultural sensitivity, too. Assessments need to be culturally appropriate, right? And sensitive to the patient's background. So pulling all of this together, how would you respond to this question?
Well, you could say something like, when I meet a new patient, my first priority is to establish rapport and create a safe and comfortable environment. I gather information through a clinical interview, asking about their concerns, their history, their background. I use those standardized assessments to kind of dig a little deeper into their symptoms and to inform my diagnosis. And I take into account their cultural background to ensure that my assessment is sensitive to that. And of course, I always make sure I get informed consent and prioritize confidentiality throughout the process.
That's a great example. It clearly shows that you understand the process, the tools, and the ethical considerations. Now, you might also get some follow-up questions related to this. For example, they might ask you to describe a specific assessment tool that you're familiar with, or ask how you would handle a situation where a patient was reluctant to participate in an assessment.
Exactly. Be ready to kind of go a little deeper with your experience and provide some specific examples that really showcase your skills and knowledge.
Great point. Okay, let's move on to another question that often comes up.
Yeah.
How do you handle difficult or challenging patients?
Ooh, yeah.
This one can be tricky
It can be.
because it requires a balance of empathy and assertiveness, right?
Absolutely.
It's about showing that you can maintain professionalism and boundaries while still demonstrating compassion.
Yes. It's important to remember that. Challenging behaviors often stem from some underlying distress or, unmet needs. And by remaining calm and understanding, you can de-escalate the situation and create a more productive therapeutic environment.
Okay, so how would you respond to this question in a way that shows you can handle those tough situations?
You could say something like, When faced with a difficult patient, I first prioritize my own safety and the safety of others. I maintain a calm and respectful demeanor and try to understand the patient's perspective, even if I don't agree with their behavior. And I set clear boundaries and communicate my expectations clearly. While remaining empathetic to their struggles, I draw upon my training in de-escalation techniques and conflict resolution. And if necessary, I would consult with my supervisor or colleagues to ensure I was handling the situation appropriately.
That's a great response. It shows you're not afraid of challenges
Right.
and that you have the skills to handle them effectively. Now, thinking about potential follow-up questions, they might ask you to describe a specific example of a challenging situation that you've encountered and how you resolved it. Or they might ask you to describe your strategies for self-care and managing stress, as this work can be emotionally taxing.
Absolutely. Be prepared to share some real-life examples that demonstrate your competence and resilience.
Okay, moving on. Let's talk about ethics. The question, can you tell us about a time when you had to make a difficult ethical decision in your work, is bound to come up.
This is where you really want to demonstrate your understanding of ethical principles and your ability to apply them in real-world situations.
RoleCatcher suggests outlining the specific ethical dilemma, the conflicting principles that are involved, and the steps you took to reach a decision.
It's also important to highlight that you consulted with your supervisor or, your colleagues, sought out guidance from the ethical codes, and prioritized the well-being of your client. It's about showing that you take ethics seriously, and you're not afraid to reach out for help when you need it.
Okay. So what kind of example could you give for this question?
You could say something like, in my previous role, I encountered a situation where a client disclosed information that suggested that they might be at risk of harming themselves. And so I was faced with this ethical dilemma of, do I maintain confidentiality? Or do I take steps to ensure their safety? So I consulted with my supervisor, reviewed the ethical guidelines, and ultimately determined that the patient's safety was the most important thing. I explained my rationale to the patient and took steps to ensure they received the support they needed.
That's a great example. It clearly shows your commitment to ethical practice and your ability to make tough decisions while prioritizing your client's well-being. Now, what kind of follow-up questions do you think they might ask after this one?
They might dig a little deeper into the specifics of the situation, like asking about the client's reaction or the steps you took to document that decision-making process. They might also ask you about other ethical dilemmas you've encountered or how you stay up to date on the changes in ethical guidelines.
Good points. It's all about showing them that you're prepared to handle those complex ethical challenges that come with this profession. Okay, let's switch gears to professional development. How do you stay current with developments in clinical psychology? Is a question that shows your commitment to lifelong learning.
Yeah, it's about demonstrating that you're not just relying on what you learned in school, but that you're actively engaged in expanding your knowledge and staying abreast of all the new research and therapies and all those best practices.
Right. RoleCatcher mentions professional journals, conferences, workshops, and memberships in professional organizations.
And don't be afraid to mention some specific areas of interest within clinical psychology that you're, currently exploring or researching. It shows that you have a real passion for the field.
So what would be a good way to respond to this question?
You could say something like, I'm committed to staying current with the latest developments in clinical psychology through various different avenues. I regularly read peer-reviewed journals, like the Journal of Abnormally Psychology and the American Psychologist, and I attend national conferences, like the APA's annual convention, to learn about, cutting-edge research and all those new therapeutic approaches. And I also participate in workshops and continuing education courses to deepen my understanding of some specific areas of interest, like trauma-informed care and mindfulness-based interventions.
That's a great answer. It highlights a proactive approach to professional development and a real passion for the field. And, they might follow up by asking about specific journals that you read, conferences you've attended, or areas of research that you're particularly excited about.
Exactly. Be prepared to, share your enthusiasm and show them you're truly invested in your own professional growth.
Okay, shifting gears a bit, let's talk about teamwork. A question like, how do you approach collaborating with other healthcare professionals, like psychiatrists or social workers? Is all about demonstrating your ability to work effectively as part of a team.
It's about showing that you value the expertise of other professionals and that you're willing to communicate effectively and coordinate care to provide the best possible support for your clients.
RoleCatcher suggests highlighting your communication skills, your ability to build relationships with other professionals, and your respect for their expertise.
Yeah. And it's also essential to emphasize your willingness to share information, coordinate care plans,
Yeah.
and work together towards common goals.
So how would you respond to this question in a way that showcases your collaborative skills?
You could say something like, I believe in a collaborative approach to patient care, and I recognize the value of working with, other healthcare professionals. I establish clear and open communication channels with my colleagues. I actively listen to their perspectives, and I respect their expertise. I regularly participate in case conferences and team meetings to discuss patient progress and coordinate those care plans. I also advocate for my patients' needs within the interdisciplinary team and ensure that their voices are heard.
That's a great response. It shows that you understand the importance of teamwork and that you're ready to collaborate effectively with other professionals. Now, what kind of follow-up questions do you think they might ask after this?
They might ask for a specific example of a time when you successfully collaborated with another professional to, achieve a positive outcome for a client. Or they might ask about your experience with interdisciplinary care conferences or your strategies for resolving conflicts, within a team.
Great points. It's about showing them you can navigate the complexities of teamwork and that you're committed to providing holistic and integrated care. Okay, let's move on to a question that assesses your cultural sensitivity. How do you approach cultural competency in your work? As our society becomes increasingly diverse, it's crucial to demonstrate your ability to provide culturally sensitive care to individuals from a wide range of backgrounds.
Absolutely. Cultural competency goes beyond just being aware of different cultures.
Right.
It involves actively seeking to understand and respect the unique values, beliefs, and experiences of your clients, and tailoring your approach accordingly.
RoleCatcher suggests highlighting your commitment to ongoing learning about different cultures, your willingness to seek supervision or consultation when needed, and your ability to adapt your therapeutic approach to be culturally responsive.
And you can also mention specific strategies you've used to, enhance your cultural competency, such as attending workshops, reading books or articles, or, engaging with diverse communities. It's about showing them that you're not just talking the talk, but you're walking the walk.
Right. So how would you respond to this question in a way that showcases your cultural sensitivity?
You could say something like, cultural competency is a core value in my practice, and I am committed to providing culturally sensitive care to all of my clients. I continuously educate myself about different cultures through reading, attending workshops, and engaging with diverse communities. I am mindful of my own biases and seek supervision or consultation when working with clients from cultures that are different from my own, and I strive to adapt my therapeutic approach to be respectful of my clients' cultural beliefs and practices.
That's a great response. It demonstrates your commitment to providing culturally sensitive care and your willingness to continually learn and grow. Now, they might follow up with a question like, can you give a specific example of a time you had to adapt your therapeutic approach to be more culturally sensitive?
Yeah, they're looking for real-life examples that showcase your ability to put your knowledge into practice.
Okay, let's move on to another question that often comes up. Can you tell us about a particularly challenging case that you've worked on and how you approached it? This is your chance to showcase your clinical judgment,
Yeah.
your ability to think critically, and your resilience
Yeah.
in the face of those complex situations.
Absolutely. It's important to select a case that, demonstrates your skills and expertise while still respecting patient confidentiality, of course.
Right.
Avoid disclosing any identifying information about the client. Instead, focus on the clinical challenges, your thought process, and the interventions that you employed.
The guide also emphasizes highlighting the outcome of the case, the lessons you learned, and how that experience has shaped your approach to therapy.
It's about showing them that you can learn from your experiences, and you're always striving to improve your skills.
So how would you approach answering this question?
You could say something like, in my previous role, I worked with a client who presented with severe anxiety and a history of trauma. And the case was particularly challenging due to the complexity of their symptoms and, their initial resistance to therapy. So I started by building rapport and establishing a safe and trusting therapeutic relationship. And I used a combination of CBT and trauma-informed approaches to address their anxiety and help them process those past experiences. I also collaborated with their psychiatrist to make sure that they were receiving appropriate medication management. And over time, the client made significant progress. Their anxiety symptoms decreased, and they developed healthier coping mechanisms. This case really taught me the importance of patience and persistence, and the power of a strong therapeutic alliance in helping clients overcome these, significant challenges.
That's a great example. It highlights your ability to handle those complex cases, apply those evidence-based interventions, and collaborate effectively with other professionals. It also demonstrates your commitment to your client's well-being and your ability to learn and grow from challenging experiences. Now, they might follow up with a question like, what specific challenges did you encounter in this case, and how did you overcome them? Or they might ask about the ethical considerations
Yeah.
that you had to kind of navigate in this particular situation.
Exactly. They're looking for evidence of your problem-solving skills, your ethical awareness, and your ability to reflect on your experiences.
Okay, let's move on to a question that assesses your ability to adapt and learn. How do you approach learning new therapeutic techniques or modalities? The field of clinical psychology is constantly evolving, with new research and therapeutic approaches like emerging all the time.
Yeah, it's essential to demonstrate your willingness to embrace new knowledge and your commitment to, continually expanding your skill set. You want to come across as someone who's curious, open-minded, and dedicated to providing the best possible care to your clients.
RoleCatcher's guide suggests highlighting your openness to new ideas, your strategies for staying informed about new developments, and your willingness to seek training or supervision to master new techniques.
Yeah, you can also mention some specific examples of therapeutic modalities that
Yeah.
you've recently learned or are interested in exploring further. This shows them that you're not just passively, absorbing information, but you're actively seeking out new knowledge and skills.
So how would you respond to this question in a way that showcases your commitment to lifelong learning?
You could say something like, I believe in lifelong learning, and I'm always eager to expand my therapeutic toolbox. I stay informed about new therapeutic techniques and modalities. By reading those professional journals, attending conferences, and engaging in peer consultation, I'm particularly interested in learning more about mentioned specific areas of interest, such as mindfulness-based interventions, acceptance and commitment therapy, or dialectical behavior therapy. I'm also open to seeking training or supervision to gain proficiency in new approaches that I believe could benefit my clients.
That's a great response. It highlights your curiosity, your commitment to professional development, and your dedication to providing the best possible care to your clients. Now, they might follow up with questions like, what specific steps would you take to learn a new therapeutic modality? Or how do you decide which new techniques to incorporate into your practice?
Exactly. They want to see that you have a thoughtful and strategic approach to your professional development.
Okay, let's switch gears to a question that often comes up in healthcare settings. How do you approach obtaining informed consent from minors and their parents or guardians? Working with children and adolescents presents these unique ethical and legal considerations, and it's crucial to demonstrate your awareness of these issues.
Yeah. Obtaining informed consent when working with minors, it kind of involves a two-pronged approach. You need to ensure that both the minor and their parents, or guardians, understand and agree to the treatment process. It's about respecting the rights of both the child and the parents, while also ensuring that the child's best interests are, the priority.
RoleCatcher's guide suggests explaining the importance of providing, developmentally appropriate information to the minor, like tailoring your language to their level of understanding,
Right.
and making sure that they feel comfortable asking questions.
It's also crucial to emphasize the importance of obtaining informed consent from the parents or the guardians, outlining the legal requirements, and addressing any potential conflicts or concerns. It's about being transparent, respectful, and collaborative.
So how would you respond to this question in a way that shows your understanding of these complexities?
You could say something like, when working with minors, I prioritize obtaining informed consent from both the child and their parents or guardians. I explain the treatment process to the child in a way that is developmentally appropriate and make sure they understand their rights and responsibilities. And I also obtain informed consent from the parents or guardians, outlining the legal and ethical considerations, and address any questions or concerns that they may have. I document the consent process thoroughly and make sure all parties involved have a clear understanding of that treatment plan.
That's a comprehensive response. It demonstrates your awareness of the complexities of informed consent when working with minors and your commitment to ethical practice. Now, they might follow up by asking about specific challenges you've encountered in obtaining informed consent from minors or their parents or guardians.
That's right. They want to see that you can navigate those tricky situations and advocate for the best interests of the child.
Okay, shifting gears again. Let's talk about a question that can be a little uncomfortable for some people. What are your salary expectations? It's important to approach this question professionally and strategically.
Yeah. RoleCatcher's Guide suggests researching salary ranges for clinical psychologists in your area. And considering factors like, your experience, education, and specialization, you want to be able to justify your expectations with, solid data.
The guide also recommends being prepared to provide a salary range rather than a specific number, allowing for some flexibility during negotiations.
Yeah. It's also important to emphasize your value to the organization, highlighting, your skills, your experience, and the unique contributions that you can make.
So how would you respond to this question in a way that balances your needs with the employer's expectations?
You could say something like, based on my research and experience, I'm seeking a salary range of a realistic range based on your qualifications and the job market in your area. I'm confident that I can bring valuable skills and expertise to this role, and I am open to discussing salary further, based on the specific responsibilities and opportunities for growth within the position.
That's a great approach. It demonstrates your professionalism, your knowledge of the industry, and your willingness to engage in a productive conversation about compensation. Now, they might follow up with a question like, what are your long-term career goals? Or, how do you see yourself contributing to the growth of our organization?
Exactly. Be prepared to articulate your career aspirations and how they align with the organization's mission and values.
All right. Let's move on to another common interview question. Why are you interested in this particular position? This is your chance to showcase your passion for the field, your alignment with the organization's values, and your specific interest in this particular role.
It's about showing them that you've done your research, that you understand their mission and values, and that you're genuinely excited about the opportunity to contribute to their work.
RoleCatcher's Guide suggests researching the organization thoroughly, understanding their mission and values,
Yeah.
and identifying specific aspects of the role that, really excite you.
Yeah, and you can also mention any personal experiences or connections to the organization's work that have inspired you. It's about making it personal and demonstrating that you're not just looking for any job, but that you're specifically drawn to their organization and what they stand for.
So how would you respond to this question in a way that conveys your genuine interest and enthusiasm?
You could say something like, I'm drawn to this position at organization name because of your commitment to mention specific aspects of the organization's mission or values that resonate with you, such as providing accessible mental health care to underserved communities or utilizing innovative therapeutic approaches. I'm particularly excited about the opportunity to mention specific aspects of the role that you find appealing, such as working with a diverse client population, specializing in a particular area of interest, or contributing to research or program development. My passion for clinical psychology stems from mention any personal experiences or connections to the field that have shaped your career aspirations, such as a personal experience with mental health challenges, a desire to help others, or a fascination with the human mind.
That's a compelling response. It demonstrates your genuine interest in the organization and the role, your alignment with their values, and your passion for the field. Now, they might follow up with a question like, what do you know about our organization's history or our current programs? Or they might ask you to elaborate on your experiences or connections to the field that have, shaped your career goals.
Exactly. Be prepared to demonstrate your knowledge and your genuine enthusiasm for their organization and their work.
Okay, let's talk about a question that often comes up towards the end of an interview. Do you have any questions for us? Asking thoughtful questions not only shows, your engagement and interest, but it also allows you to gather valuable information about the organization and the role.
It's your chance to show them that you're curious, that you're thinking critically about the opportunity, and that you're eager to learn more about their organization and the role you'd be playing.
RoleCatcher's Guide suggests preparing a list of questions in advance, focusing on areas such as the organization's culture, the team dynamics, professional development opportunities, or the specific challenges and rewards of the role.
Yeah, and you can also ask clarifying questions about anything that was discussed during the interview, or inquire about, the next steps in the hiring process.
So, what are some examples of questions you could ask?
Well, here are a few ideas. What is the organization's approach to professional development and continuing education? Or, what are the greatest challenges and rewards of working in this role? Can you describe the team dynamics and the level of collaboration within the department? What are the organization's plans for growth and innovation in the field of mental health care? What are the next steps in the hiring process? Things like that.
Asking insightful questions shows that you're genuinely interested in the opportunity and that you're a thoughtful and engaged candidate. Okay. Let's move on to a question that assesses your understanding of professional boundaries. Can you describe a situation where you had to establish or maintain professional boundaries with a client? End quote. Maintaining appropriate boundaries is essential in any therapeutic relationship. And this question gives you an opportunity to demonstrate your understanding of ethical principles and your ability to apply them in real-world situations.
It's about showing them that you understand the importance of boundaries. In maintaining a safe and ethical therapeutic relationship, you want to demonstrate that you can set limits while still being empathetic and respectful.
RoleCatcher's Guide suggests selecting a situation that highlights your professionalism, your commitment to ethical practice, and your ability to communicate boundaries effectively.
It's also important to emphasize the importance of seeking supervision or consultation. When navigating, complex boundary issues, it shows that you're not afraid to ask for help when you need it, and that you're committed to ethical practice.
So what kind of example could you give for this question?
You could say something like, in my previous role, I had a client who repeatedly tried to contact me outside of our scheduled sessions, often about, non-emergency matters. So I recognized the importance of maintaining those professional boundaries and explained to the client that I was only available to address their clinical concerns during our scheduled appointments. And I also provided them with some alternative resources for non-emergency support, such as like a crisis hotline or a support group. And of course, I documented these interactions and consulted with my supervisor to make sure I was handling the situation appropriately.
That's a great example. It demonstrates your understanding of professional boundaries, your ability to communicate them clearly, and your commitment to ethical practice. Now, they might follow up with a question like, what are some common challenges you've encountered in maintaining professional boundaries, and how have you addressed them?
Exactly. They want to see that you've thought about the complexities of boundaries and that you have strategies for navigating those challenges.
Okay. Let's move on to another question that assesses your ability to handle challenging client dynamics. How do you handle situations where you feel your personal values or beliefs conflict with the client's values or beliefs? As a clinical psychologist, you'll inevitably encounter clients whose values or beliefs differ from your own. And it's crucial to demonstrate your ability to navigate those differences respectfully and professionally.
Yeah, it's about showing them that you can set aside your own personal biases and provide compassionate and ethical care to all clients, regardless of their beliefs or values.
RoleCatcher's Guide emphasizes the importance of self-awareness, recognizing your own biases, and seeking supervision or consultation when needed.
Yeah. It also suggests highlighting your commitment to providing non-judgmental care and respecting the client's autonomy, even when their values are different from your own. It's about showing that you're committed to ethical practice, expert speaker. It's about showing that you're committed to ethical practice and that you understand the importance of respecting client diversity.
So how would you respond to this question in a way that demonstrates your sensitivity and professionalism?
You could say something like, I'm aware that my personal values and beliefs may differ from those of my clients, and I strive to approach those differences with respect and sensitivity. I prioritize creating a safe and welcoming therapeutic environment where clients feel comfortable sharing their perspectives, even if they're different from my own. If I encounter a situation where my personal values or beliefs significantly conflict with the client's values, I seek supervision or consultation to explore how to best navigate that situation, while maintaining ethical practice and prioritizing the client's well-being.
That's a thoughtful response. It demonstrates your self-awareness, your commitment to ethical practice, and your ability to handle potentially challenging situations. Now, they might follow up by asking you to describe a specific example of a time you had to work with a client whose values or beliefs differed from your own.
That's right. They want to hear about real-life situations and how you successfully navigated those challenges while maintaining your ethical integrity.
Okay, let's talk about receiving feedback, which is essential for growth. A question like, can you tell us about a time you received negative feedback and how you responded? Give you a chance to show how you handle criticism.
It's a great opportunity to demonstrate that you're open to feedback, that you can learn from your mistakes, and that you're committed to continuous improvement. Nobody's perfect, and employers want to see that you can take constructive criticism and use it to grow.
RoleCatcher's Guide suggests selecting a specific example where you receive feedback that was, like, challenging or unexpected, outlining the situation, your initial reaction, and the steps you took to address that feedback.
Yeah, it's also important to highlight what you learned from the experience and how it has shaped your approach to your work.
So how would you respond to this question in a way that shows your ability to handle feedback constructively?
You could say something like, in my previous role, I received feedback from a supervisor that I was sometimes too direct in my communication with clients, and that this could be perceived as insensitive. Initially, I felt defensive, but I took some time to reflect on the feedback and recognize that there was truth in it. So I committed to working on my communication style, focusing on being more empathetic and validating clients' feelings. While still providing honest and constructive feedback, I sought out some additional training in communication skills and practiced some active listening techniques. And I am grateful for the feedback I received because it helped me to become a more effective and compassionate therapist.
That's a great example. It demonstrates your willingness to receive feedback, your ability to reflect on your kind of strengths and weaknesses, and your commitment to that continuous improvement. It also highlights your maturity and your ability to turn a potentially negative experience into a positive learning opportunity. Now they might follow up with questions like, how do you typically seek out feedback? Or what are some areas where you're currently working to improve your skills?
Exactly. Be prepared to show them that you're proactive in seeking feedback and that you're committed to ongoing professional growth.
Okay. Moving on to another question that assesses your problem-solving skills. Let's tackle. Describe a situation where you had to make a difficult decision with limited information. Clinical psychologists often face situations where they need to make decisions with incomplete or ambiguous information, right?
Yeah, that's true. This is your chance to showcase your clinical judgment, your ability to gather and evaluate information, and your ability to weigh potential risks and benefits, even when you don't have all the answers.
The guide emphasizes selecting a situation. That highlights your analytical skills and your ability to consult with colleagues or supervisors when appropriate, demonstrating your commitment to ethical decision-making.
It's about showing them that you can think on your feet, make sound judgments, and seek guidance when you need it.
So how would you approach answering this question?
You could say something like, in my previous role, I was working with a client who was experiencing suicidal thoughts, and the client was reluctant to disclose any specific details about their plan or intent, which made it really challenging to assess their level of risk. So I carefully gathered as much information as I could, like their history, current stressors, and support system. I consulted with my supervisor and reviewed the relevant risk assessment guidelines. And based on the limited information available, I determined that the client required a higher level of care and initiated the process for a psychiatric hospitalization. While the decision was difficult, I prioritized the client's safety and well-being, drawing upon my clinical judgment and the available evidence.
That's a great example. It demonstrates your ability to make sound decisions under pressure, your commitment to client safety, and your ability to draw upon your clinical expertise and available resources. Now, they might follow up with a question like, what were the factors you considered in making your decision? Or how did you communicate your concerns to the client and their support system?
Right. They're looking for evidence of your critical thinking skills, your communication skills, and your ability to navigate those complex situations with sensitivity and professionalism.
Okay, let's shift our focus to a question that assesses your understanding of the importance of self-care in this demanding profession. How do you prioritize self-care and prevent burnout in this demanding field? Working as a clinical psychologist can be emotionally challenging, and it's essential to demonstrate your awareness of the risks of burnout and your commitment to implementing effective self-care strategies.
It's about showing them that you understand the importance of taking care of yourself, to avoid burnout, and that you have strategies in place to maintain your well-being and prevent compassion fatigue.
RoleCatcher's guide suggests highlighting specific activities or practices you engage in, to manage stress, maintain boundaries between your work life and personal life, and nurture your own mental and emotional health.
Yeah. You can also mention any support systems you rely on, like colleagues, supervisors, friends, family, or your own personal therapist. It's about showing that you have a holistic approach to self-care and that you're proactive in taking care of your own well-being.
So how would you respond to this question in a way that highlights your commitment to self-care?
You could say something like, I recognize that working as a clinical psychologist can be emotionally demanding, and I prioritize my well-being to prevent burnout and maintain my effectiveness as a therapist. I engage in regular exercise, spend time in nature, practice mindfulness, and prioritize quality time with my loved ones. I also set clear boundaries between work and personal life, avoiding, checking emails or taking calls outside of work hours. I have a strong support system of colleagues, friends, and family who I can turn to for guidance and support. I also see a therapist regularly to process my own experiences and make sure that I'm taking care of my own mental health.
That's a thoughtful and comprehensive response. It demonstrates your awareness of the importance of self-care, your commitment to your own well-being, and your ability to implement those effective burnout prevention strategies. Now, they might follow up with a question like, what are some specific challenges you've encountered in maintaining self-care, and how have you overcome them? Or they might ask about your strategies for recognizing the signs of burnout in yourself and in others.
Exactly. They're looking for evidence
Yeah.
that you have a realistic understanding of the demands of the profession and that you're prepared to take those proactive steps to protect your well-being.
Okay. Let's talk about evidence-based practice, which is a cornerstone of clinical psychology. The question, how do you incorporate research findings and evidence-based practices into your clinical work? Is a way to show that you're committed to using treatments and interventions that are backed by, scientific evidence.
Yeah, it's about showing them that you're not just relying on intuition or personal experience, but that you're committed to staying up to date on all the latest research and integrating that knowledge into your practice.
RoleCatcher's guide suggests highlighting your familiarity with relevant journals, your ability to critically evaluate research findings, and your willingness to adapt your practice based on, new evidence.
You can also mention specific examples of evidence-based therapies or interventions that you utilize in your work. It's about showing them that you're not just talking about evidence-based practice, but you're actually living it.
So how would you respond to this question in a way that showcases your commitment to using those evidence-based practices?
You could say something like, I'm committed to incorporating research findings and evidence-based practices into my clinical work. To provide the most effective and ethical care to my clients, I regularly read peer-reviewed journals, such as mention-specific journals, and attend conferences to stay informed about the latest research in the field. I critically evaluate research findings and consider their applicability to my client population and my practice setting. I utilize evidence-based therapies, such as cognitive behavioral therapy, dialectical behavior therapy, and acceptance and commitment therapy in my work. I'm also open to adapting my practice based on new evidence, and I'm committed to lifelong learning in the field.
That's a great response. It demonstrates your commitment to evidence-based practice, your ability to critically evaluate research findings, and your willingness to adapt your practice based on that new knowledge. Now, they might follow up with questions like, what are some specific journals or conferences? Now they might follow up with questions like, what are some specific journals or conferences that you follow? Or, how do you stay informed about new research findings that are relevant to your practice?
Exactly. They want to see that you're actively engaged in the research community and that you're committed to, staying on the cutting edge of your field.
Okay. Let's talk about diversity and inclusion, which are such essential values in clinical psychology. The question, how do you approach working with clients from diverse backgrounds and with a range of identities and experiences? Shows your understanding of the importance of cultural humility and your ability to provide culturally competent care.
Yeah, it's about demonstrating that you recognize and value, the unique experiences and perspectives of clients from all walks of life, and that you're committed to creating a safe and welcoming therapeutic environment, for everyone.
RoleCatcher's guide suggests highlighting your commitment to cultural humility, your willingness to learn about different cultures and identities, and your ability to adapt your therapeutic approach to be culturally responsive.
And you can also mention any specific experiences or training you've had in working with diverse populations. It's about showing them that you've taken, concrete steps to develop your cultural competence and that you're committed to ongoing learning and growth in this area.
So how would you respond to this question in a way that kind of showcases your sensitivity and inclusivity?
You could say something like, I am committed to providing culturally competent care to all of my clients, and I recognize the importance of diversity and inclusion in my work. I approach each client with cultural humility, recognizing that I don't have all the answers, and I'm always willing to learn from my clients' experiences. I engage in ongoing education about different cultures and identities and experiences through reading, attending workshops, and engaging with diverse communities. And I strive to create a safe and welcoming therapeutic environment where clients feel comfortable, sharing their identities and experiences. without fear of judgment. And I also adapt my therapeutic approach to be culturally responsive, considering the client's cultural background, values, and beliefs in the treatment process.
That's a thoughtful and inclusive response. It demonstrates your sensitivity to diversity and your commitment to providing culturally competent care. Now, they might follow up with a question like, can you give an example of a time you had to adapt your therapeutic approach to be more culturally sensitive?
Mhm.
Or they might ask about specific challenges you've encountered in working with clients from diverse backgrounds and how you've kind of navigated those challenges.
Exactly. They want to see that you're able to apply your knowledge of cultural humility to real-life situations.
Okay, let's talk about client resistance, which is a common challenge in therapy, right?
Oh, yeah.
A question like, how do you approach working with clients who are resistant to therapy or who express skepticism about the therapeutic process? Shows your understanding of this dynamic and your ability to engage these clients effectively.
Yeah, it's about demonstrating that you can empathize with their resistance, validate their concerns, and work collaboratively with them to build trust and establish that therapeutic alliance.
RoleCatcher's guide suggests highlighting your empathy, your active listening skills, and your ability to validate the client's concerns.
It also recommends emphasizing the importance of collaboration, working with the client to establish shared goals and tailoring that therapeutic approach to their needs and preferences. It's about showing that you're flexible, client-centered, and willing to meet clients where they are.
So how would you respond to this question in a way that showcases your ability to engage those resistant clients?
You could say something like, I understand that it can be challenging to enter therapy and that some clients may feel, resistant or skeptical about the process. So I approach these clients with empathy and respect, recognizing that their resistance or skepticism may stem from past experiences or cultural beliefs or, personal anxieties. I actively listen to their concerns, validate their feelings, and work collaboratively with them to establish a trusting therapeutic relationship. I explain the therapeutic process in a transparent and understandable way, addressing any questions or misconceptions that they might have. And I also work with clients to establish shared goals and tailor the therapeutic approach to their needs and preferences, ensuring that they feel empowered and involved in their own treatment.
That's a great response. It demonstrates your understanding of client resistance, your ability to build rapport with, like, those challenging clients, and your commitment to collaborative and client-centered care. Now, they might follow up with a question like, can you give an example of a time you successfully worked with a resistant client? Or they might ask about specific techniques that you use to build trust and rapport with clients who are kind of hesitant to engage in therapy.
Exactly. They want to hear about your real-life experiences and how you've successfully applied those skills to challenging situations.
Okay, let's talk about the connection between physical and mental health, which is an important consideration in clinical practice. A question like, how do you address the impact of physical health conditions on mental health in your clinical work? Shows your understanding of this interplay and your ability to provide, like, holistic care.
Yeah. It's about demonstrating that you recognize that mind-body connection and that you consider the impact of physical health on, mental well-being.
RoleCatcher's guide suggests highlighting your awareness of the biopsychosocial model, your knowledge of common mental health challenges that are associated with physical health conditions, and your ability to collaborate with other healthcare professionals to provide integrated care.
You can also mention any specific examples of how you've addressed the impact of physical health conditions on, mental health in your previous work. It's about showing them that you have experience working with clients who have, co-occurring physical and mental health conditions, and that you understand the importance of a collaborative and integrated approach to care.
So how would you respond to this question in a way that highlights your understanding of this important connection?
You could say something like, I recognize the significant impact that physical health conditions can have on mental health and well-being. And I approach my work from a biopsychosocial perspective, considering the interplay between biological, psychological, and social factors in, understanding and treating my clients. I'm familiar with some common mental health challenges that are associated with, various physical health conditions, such as, depression and anxiety related to chronic pain, or adjustment disorders following a major medical diagnosis. I collaborate closely with other healthcare professionals, like physicians, nurses, and physical therapists, to provide integrated care and address the client's needs holistically. I also educate my clients about that mind-body connection and empower them to take an active role in managing both their physical and mental health.
That's a comprehensive response. It demonstrates your understanding of the interplay between mental health and physical health, your ability to collaborate with other healthcare professionals, and your commitment to providing that holistic care. Now, they might follow up with a question like, can you give an example of a time you worked with a client who had both physical and mental health concerns?
Mm-hmm.
Or they might ask about your experience collaborating with other healthcare providers, or your knowledge of, specific resources for clients with chronic health conditions.
Exactly. They're looking for concrete examples that demonstrate your experience and your ability to apply your knowledge to real-life situations.
Okay, let's talk about technology, which is becoming increasingly integrated into mental health care. A question like, how do you incorporate technology into your clinical practice? And what are your views on the ethical considerations of using technology in therapy? Shows your understanding of the potential benefits and challenges of technology in mental health care.
Yeah, it's about demonstrating that you're open to, embracing new technologies while also being mindful of the ethical implications and potential risks.
RoleCatcher's guide suggests discussing specific technologies that you utilize or are familiar with, like, telehealth platforms, mental health apps, or virtual reality therapy.
Yeah, it also recommends addressing ethical considerations, such as, client privacy, confidentiality, and the potential for technology to, exacerbate existing inequalities. In access to care, it's about showing them that you're not just tech savvy, but that you're also thoughtful about the ethical and social implications of using technology in a therapeutic setting.
So how would you respond to this question in a way that showcases your balanced perspective on technology and mental health care?
You could say something like, I am open to incorporating technology into my clinical practice in ways that, enhance client care and accessibility. I'm familiar with various telehealth platforms and have experience providing therapy remotely. And I also recognize the potential benefits of mental health apps and virtual reality therapy in providing, accessible and engaging interventions. However, I am mindful of those ethical considerations of using technology in therapy, such as, ensuring client privacy and confidentiality, addressing any potential technical issues, and being aware of the potential for technology to make those inequalities in access to care even worse. So I approach the use of technology in my practice thoughtfully, prioritizing client well-being and ethical considerations.
That's a balanced and insightful response. It demonstrates your awareness of the potential benefits and challenges of technology in clinical psychology, and your commitment to ethical practice. Now, they might follow up with questions like, what are your thoughts on the use of AI in mental health care? Or how do you address that digital divide and ensure that your services are accessible to clients who may not have access to technology?
Exactly. They want to see that you're thinking critically about the evolving role of technology in mental health care and that you're prepared to address the ethical and practical challenges that come with it.
Okay. Before we wrap up our deep dive into these interview questions, I want to touch on something that RoleCatcher emphasized in their career guide: the importance of understanding the role of a clinical psychologist beyond the interview. It's easy to get caught up in the interview process, but it's important to remember why you're pursuing this career in the first place, right?
Absolutely. It's about having a clear understanding of what this career entails day to day, the challenges and rewards, and the different paths that you can take.
RoleCatcher's guide talks about the core functions of a clinical psychologist: diagnosing, rehabilitating, and supporting individuals with mental health issues.
It's about using evidence-based methods to help people understand and cope with their challenges, improve their quality of life, and, reach their full potential.
And it's important to remember that this is not a one-size-fits-all role.
That's right. You could work in a variety of settings, from hospitals and clinics to schools and private practices. You could specialize in a particular population, like children, adolescents, adults, or older adults. Or you could focus on a specific area of interest, like anxiety disorders, mood disorders, trauma, or substance abuse.
It's a field with a lot of options and opportunities for growth and specialization.
And one thing that RoleCatcher highlights that I think is really important is, the emotional demands of this work. It can be incredibly rewarding, but it can also be really challenging and emotionally taxing.
That's right. It's important to be aware of the potential for burnout and to have those strategies in place for self-care and maintaining your own well-being.
And that's why I think it's so important to, have this kind of deep dive before your interview. It's not just about preparing for the questions. It's about making sure that this is truly the right path for you and that you're prepared for the challenges and rewards that come with it.
And I love that perspective. It's about finding a career that aligns with your values, your skills, and your passion.
Exactly. And that's what will shine through in your interview.
Okay. So to wrap things up, I just want to say we've covered a lot of ground today, but hopefully this deep dive has given you a solid foundation. For acing that clinical psychologist interview, remember to be yourself. Showcase your passion for the field, and be prepared to answer those tough questions with confidence and clarity. And don't forget to check out RoleCatcher's platform for personalized support and guidance.
Best of luck on your interview journey. You've got this.
Until next time, keep diving deep and keep learning.